This conference is hopefully going to make people be more knowledgeable about what is available. Our hope is that it helps us to have people advocate for programs across the state, to forward the knowledge that we give people. So whether you live and work in the space like I do, or you don't, and you dabble in it, or you have some exposure through some other venue, that you can make a difference in advancing palliative care so people across the state can benefit from these services, so we do better with healthcare as a whole.
The doctors in the office who are dealing with patients who are frustrated with how they're feeling, we don't always reach out and think of that. I think sometimes the doctor feels like we're supposed to do all of that. And even as an internist, we do a lot of that. And as a geriatrician, we do a lot of that. But even these added support from all the team members in palliative care really helps our patients.
As a nurse and as a hospital association, palliative care is the extension of services to really consider what patients need and how do we best provide holistic care to the patient wherever they are. And as we face an aging population, this is becoming more and more of an important topic.
So palliative care is important to the Tennessee Commission on Aging and Disability. In terms of what we deal with every day, we're talking with people who are running into conditions, diseases, serious illnesses. And you know, as you get older and you, I think, are probably more focused on your health, palliative care is one aspect of health care that I think people do need to know about.
I see a lot of chronic illness as an internist and geriatrician. Some illnesses that can be cured, and during that time people are having to deal with management of those issues. So for example, they're in cancer chemotherapy and they're losing hair and they're short of breath and they feel weak and tired. Palliative care can step in and really help people. And it's been shown that patients do better with palliative care added to their management, even in a curable or non-curable disease.
And then when we face chronic diseases, and particularly as we age, I think that's when in the continuum of care, we need to talk about what does quality of life mean as we're aging? What can we expect in that aging process? And what are the things we want to consider now as we think about advanced care planning for ourselves and our loved ones?
As representing the Tennessee Medical Association, which represents all specialties of medicine, and the ACP, which represents internal medicine, we deal with a number of chronic illnesses which people may live with for 10 to 20 years or maybe a shorter time. It's very important that we realize to help patients with these illnesses that we involve symptom management and quality of care, and not just look at a blood pressure or a lab value as being better or worse.
I hope you'll be able to join us on September 27th for our upcoming Palliative Care Conference. I think you'll leave armed with better information and actions that you can put in place in your practice as soon as you leave. We hope to see you there.